Thanks so much for joining us for this special edition of your trusted local podcast. I'm Danielle Wagner, and joining me is Mia Bearden. And Mia, you've been working on an I-9 investigative piece for quite a while now. It is talking about opioids.
Yes.
And specifically how doctors and hospitals are changing how they treat pain, which this has been an ongoing topic not only in Iowa but across the country. What I find really interesting too is that you spoke with a family directly impacted by this. What can you tell me about the Courtneys and their story?
Yeah, absolutely. Great question. So I spoke with Rod and Deb Courtney, and unfortunately they did lose their son in 2016 to a fentanyl overdose. And even before that, starting in high school, he always dealt with substance use disorder. It started with alcoholism, it went to cannabis use, and then it kind of snowballed into heroin. So he always dealt with that issue. And I think what's important to note here, what the Courtneys told me, is that they always held on to hope when it came to their son. They always knew that he always wanted to try to go to treatment. He always wanted to try to get better. And that was a really big part of their story. And part of that story is around in his 30s when he was trying to get better. He had gotten better for about a year. He was actually clean for almost a year. And he had gotten a job, but on that job, he had an injury with his shoulder and he had to get surgery. And that kind of brings us to our topic, and he got prescribed opioids by that doctor. And unfortunately, that snowballed that issue again. It flared up that addiction again. So and that kind of leads us to where we are here today. So
I just want to point out too that this isn't an easy topic to speak about, especially for families who have lost someone. So just a real special thank you to the Courtneys for being willing to share their story, because not everyone is comfortable doing that.
It's not easy. It's extremely heartbreaking, and it's really hard to talk about that topic.
Absolutely. Okay. So Iowa hospitals, we briefly mentioned, are changing or starting to change the way that they manage pain. This is a significant shift. Tell us about this.
Yes, this is a huge shift. So spearheaded by Goldfinch Health, they're starting they have a program that they started called the Billion Pill Pledge. And what they're doing is it's actually implemented in 10 Iowa hospitals right now. And they're helping with looking at other forms of pain management, making sure that opioids are not a first choice. Not completely getting rid of them, realizing that they have their place.
Sure, they can serve a purpose.
Yep, absolutely, but realizing there are other ways of pain management and working to have that as a first option. And then hopefully that means fewer opioids in the end. And, you know, they do more than just worry about pain. They also worry about the emotional support that some of these patients are getting. Their patients are working with the nurse one-on-one. You know, they're getting that education about opioids. They're getting that education about other forms of non-opioid pain medication.
Okay, because when we think of pain management, yes, the go-to for so long has been opioids. So I'm sure it's also reconditioning, you know, medical people in the community, but also just the average person that know the opioid doesn't have to be the go-to.
Exactly, and the average person might not know that, and that's why they're really trying to educate and show you different pathways, not more than just one pathway.
And that educational aspect, I also think, is just really interesting that you talked about, because so much of that is just kind of spreading that message and informing people and letting them know that this is available.
Yep, absolutely. And part of knowing that this is available is when a nurse works with those patients. I spoke to a nurse who is working with patients, and she told me that she did have a patient who is an addict, and he had to get surgery, and, you know, opioids is potentially a part of that.
Yeah, it can be scary knowing that you have an addiction and knowing you might need something else after a big event.
Exactly, and she was telling me he was so scared to fall down that rabbit hole again, so scared to relapse again. But that's why they have this program, and they worked side by side with him, told him the different options, and he came out of that clean. And so that's just one instance where Iowa, and with this program, that there's other avenues available. So.
And in his case, that particular case,
in this case,
worked.
It did work. Yeah.
Okay, good to know. And we've talked a little bit about there's been an opioid settlement. We've mentioned it in our newscasts, and people in the state probably know that. So speaking of this opioid settlement, that was a significant sum of money. How was that money being used?
Yeah, so specifically, Iowa is receiving $38.2 nearly $38 million. And some of that money is going to recovery programs. So I would say going back to Rod and Deb Courtney, they have a program where they work with different addicts, and they have a recovery program where they can come in, get help, get support, and really just help them on their journey. And they received $900,000 as part of that opioid settlement money. So, you know, it's going to different programs. It's going to Rob and Deb, where they can just really try and use that to advocate for other families.
And how impressive on their part as well to turn something clearly very negative in their lives and turning it into a way to hopefully help others.
Absolutely.
So let's talk about the Courtneys. They have programs. You mentioned Crush, Billion Pill Pledge. Their son, Chad, no longer here. Do the Courtneys think that programs now available could have made a difference? I mean, it's hard to look back and kind of wish and wonder what could have happened, but would they have liked these programs to have been around then?
And I'm really glad you asked that question, because I did ask them that question as well specifically, and they told me absolutely that could have changed his outcome. They said back in 2016, when he did pass away, there just weren't as many treatment options available, and there was a huge stigma around addiction. And so that's why they're really working to try and change that stigma. And if he had, you know, he was always wanting to go to treatment. He was always trying to get help. And if they had a few more programs like what they're doing, like Billion Pill Pledge is doing, they feel like he would have had a different outcome, specifically with him. That's what they told me.
And I think that's a great point, too, to also mention that, yes, help now is more prevalent, more available, so you don't have to maybe suffer alone or suffer in silence, and you can reach out to groups and organizations and get that help if you desire it.
Yeah, absolutely. And that's what they're trying to do. They're trying to change the stigma, and they're just trying to offer support, because some families don't have that support. Some people are on their own, you know, going back to the nurse who works with patients. Some patients, they just don't have that support. And when they come home and they have these opioid prescriptions, knowing again that you can either call Rod and Deb's organization, you can call that nurse, you know, and just be like, I need support, I need help, and that wasn't available in 2016.
I think those of us who maybe have support underestimate or don't always appreciate how important and impactful that is. So to be able to offer that to other people who maybe, as you said, don't have that built-in support system, I think that is fantastic.
It's huge.
Talk about prescription rates. Are these changes actually making a difference in the state when it comes to prescription rates?
Now, according to the CDC, yes, Iowa's opioid prescription rate has dropped by nearly half, in the past 15 years. Now, specifically with the numbers, from 59 prescriptions per 100,000 people to now in 2023 to 35. So that's actually a significant difference from 2008 to 2023. So from the CDC, from the rates that we're seeing statistically, it is dropping. And that's the kind of progress paired with, you know, community programs and better medical practices, you know, having opioid prescriptions as a last resort. I think that's some of the change that the Courtneys are really trying to advocate for, and that's really their goal. So.
Well, I think it's, again, very impressive what they're doing, and I look forward to seeing your story and learning a little bit more about what they're doing and how this diversion, so to speak, with the hospitals on board as well, is making a difference.
Yeah, and we'll see how it changes in the future and what continues to be developed. You know, we're only starting from here, you know, with this opioid settlement money. We'll see where the funds go and what change happens. So,
well, Mia Bearden, thank you so much for taking the time to speak with me, and thank you for tuning in again to this special edition of your trusted local podcast.